Hi everyone, my name's Brooklyn, and today I'm going to be talking to you about the importance of verbal and nonverbal communication in physical therapy. So imagine walking into a clinic, you're uncertain, you're in pain, and you're seeking help to regain your mobility. The first interaction that you're going to have before exercises or treatments begin is with your physical therapist. And in this initial exchange, the foundation of your treatment is built. And that's not just through words, but through gestures, expression, and tone. So I'm going to be talking about this in both the patient's perspective as well as the physical therapist perspective. I chose this topic because I'm very passionate about physical therapy and the benefits that are behind it if it's used properly and in the correct situation. Physical therapy helps many people regain their independence and improve their quality of life. So imagine seeing someone walk again after they were told they never would. How inspiring is that? I myself have experienced injuries and had to participate in physical therapy, so I've had many firsthand experiences with verbal and nonverbal communication in this healthcare environment. I'm also employed at a physical therapy clinic, so I've witnessed the wonders that are worked whenever a patient is fully invested in their experience. My overall career goal is to become a physical therapist assistant, so this research has definitely benefited me in my future endeavors. This speech will explore the importance of verbal and nonverbal communication in physical therapy by going through tactics, examples, as well as case studies. So, I want to share my research in hopes that it can help others who may experience physical therapy, maybe they're currently going through it, and just help educate them so that they too can get the best outcome out of the treatment just like I did. So, my main research point has been to find out how positive communication as a whole is beneficial to a patient's treatment plan and long-term outcome after therapy. I've also found many tactics to guarantee that positive verbal and nonverbal communication is used in the physical therapy field. While researching, I discovered that positive communication habits foster understanding and trust between the patient and therapist. This relationship can greatly improve the patient's overall outcome after receiving treatment. In physical therapy, communication goes much further than just exchanging conversation here and there. Verbal communication is far more than just the exchange of information, it's the foundation of effective care. Verbal communication allows therapists to clearly explain diagnosis, treatment plans, as well as the exercises to the patients. So, this helps set expectations, answer questions, and most importantly, build the relationship between the therapist and the patient. Um, so the tone the physical therapist uses with the patient is also very important because it determines the clarity of the conversation and even the participation that the level of participation that the patient's going to put forward. The tone used can also affect the patient's comfort level and willingness to participate in therapy. So, active listening, where therapists attentively hear and respond to the patient concerns, builds trust. So, this collaborative dialogue not only empowers patients, but it also enhances their engagement in the rehabilitation process. So, according to the National Library of Medicine, such patient centered communication can lead to improved outcomes and greater satisfaction with their care. So, nonverbal communication is just as important, if not more so. So, many patients are in pain and they could also be anxious, frustrated, lots of other feelings. So, people usually pick up on body language before they even hear words. So, a smile, open posture, and eye contact can instantly create a sense of safety, making it more welcoming for the patient. Um, so, therapists' nonverbal cues can convey empathy, attentiveness, and even professionalism. So, usually, nonverbal communication can speak louder than words. For instance, maintaining open posture and appropriate eye contact makes patients feel more comfortable and more valued. So, in contrast, crossed arms or disgracing glances can signal disinterest. According to Bridget Allison, she has found studies that have shown that the effective nonverbal communication enhances the therapeutic relationship and can encourage patient participation. So once again, that's even a study proving that patient participation goes up whenever the therapist acquires good nonverbal communication habits. So nonverbal cues not only help us receive information from our patients, so facial expressions, body tension, and gestures can often reveal discomfort or hesitation that might not be voiced out loud. So as therapists, it's their responsibility to observe and interpret these signals and adjust the treatment accordingly to how the patient is feeling. So ultimately, effective communication, both verbal and non-verbally, increases patient adherence and leads to overall better outcomes. It's not just about what we say, but how we say it and what we show without saying anything at all. So in the realm of physical therapy, effective communication, both verbally and non-verbally, is not only beneficial, but it's essential. Verbal communication allows therapists to convey treatment plans, meet expectations, and provide encouragement, fostering a clear understanding between the therapist and the patient. So equally important, nonverbal cues such as body language, eye contact, tone of voice can play a very large role in building trust as well as empathy. So the subtle signs often reveal a patient's unspoken concerns or discomfort, enabling therapists to respond with greater sensitivity and care. So, research indicates, the research by the National Library of Medicine can indicate that nonverbal communication can significantly influence a patient's participation and outcomes in physical therapy sessions. Thank you guys for listening.